What's up, everybody, and welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosey, joined by my friend and co-host, Keoni Tita. Keoni, how are you today?
I'm doing wonderful. Today I wanted to talk about peripheral neuropathy because I know both you and me, you're going to start seeing it a lot, and I see it a hell of a lot. And basically what peripheral neuropathy refers to is any conditions that result when nerves that carry messages from the brain and the spinal cord from and to the rest of the body are damaged or diseased. So basically it's just nerves outside of the central nervous system that are damaged or diseased.
Yeah, losing some sort of function there in that nerve.
And when you lose some sort of function, what's happening? You get kind of, especially the peripheral nerves, you get weird sensations. You may even, if they're damaged enough, you may even get some motor symptoms and stuff like that. But typically peripheral neuropathy shows up in people with just weird, like numbing sensations, tingling, cold sensations, burning. I see like numb, burning feet. A lot is a symptom I see with it. So it's pretty miserable. I mean, this can keep people up at night. It can completely ruin quality of life. And most of the cases that I see are coming from people who have uncontrollable sugar levels like diabetes or anything like that. So we know that high blood sugar levels will damage nerves. It will also decrease blood flow, which then again will damage nerves. And then probably more so than that, unfortunately, that I see than with people with diabetes is chemotherapy-induced peripheral neuropathy. So any chemotherapy the bout has the potential to cause nerve damage. It just tends to be one of those side effects. And typically people, will recover after 1 to 3 years. It just depends on the extent, but the high percentage of them don't recover. So they permanently have this peripheral neuropathy from chemotherapy.
Right.
But as you know, Brian, like these peripheral nerves come out of the spinal cord, and they're arranged along lines in the body called dermatones. So typically wherever that nervy sensation, you can feel it really anywhere. You can feel it on any dermatome. Most of the time we feel it on the dermatones of the feet. I see it on the dermatones of the feet and the hands primarily.
Yeah,
right.
Absolutely.
But if you know the dermatones, then you know what nerve roots are being affected, right? Or what nerves coming out of the spinal cord are being affected primarily. So on the feet, I see it on the bottoms of the feet a lot. So if it's like affecting the big toe and the second and third toe, I know that it's coming from the medial plantar nerve. And then if it's coming from the lateral side of the foot, it's a lateral plantar nerve. And these nerve roots tend to be L4, L5, S1, S2, for the most part. But you can actually, once you know the dermatome, you can isolate it to the nerve that's actually being damaged.
Yeah. So you essentially have a highway system there, and that the nerve root Keoni's talking about is where you would take off from, or your biggest highway. And then from there, it branches off into a bunch of little things that we can trace back to, like the plantar nerves.
Right.
Absolutely. But you can see how it would become, even like in physical therapy, you become a fall risk. You can't see things, you're tripping over things. If you do, to a certain point, not that you can't see things, but you're not aware of things, or maybe where your feet are, and you may trip over a small ledge or something like that. And then it just starts this cascade of other negative events.
Right.
So it's definitely something that has to be addressed. And it's, like you said, extremely painful. It can be.
Yep. And most of the time, the kinds of peripheral neuropathy, they kind of fall into two groups. There's like mononeuropathy and polyneuropathy. The things that me and you are going to see the most are polyneuropathy, or that we see most, like where multiple dermatomes are affected. Certain, areas of the feet, foot, and hands are affected. And we're talking about feet and hands, but really this neuropathy can affect any nerves coming out of the CNS, central nervous system, right? And so it could even affect, your adrenal glands. It can affect your heart. It can affect anything. So you can have weird kind of symptoms from this depending on how severe it is. Like you can have significantly low blood pressure. You can have excessive sweating from this. And, it's due to a neuropathy of some sort. And it may not be easily found because with those symptoms, because the stereotypical ones are numbness and tingling of feet and the hands. And then you kind of get an idea, especially based on history, where, what the diagnosis is, peripheral neuropathy.
Yeah. Yeah. I would say from my perspective, the biggest component of it is just the history.
Right. And then, like mononeuropathy is when one nerve is kind of affected. So an example of that would be like carpal tunnel, where you get the numbness and tingling in like your, certain hands. It's affecting that. What is it? The medium nerve?
Yeah, the median nerve. Yep.
Yeah. So anyway, two types there, but most of the time, and carpal tunnel is repetitive movement, right? So that's just, if you take away the repetitive stimulus and just help keep the muscles supple and flexible and from impinging on the nerves and stuff, and keep the blood flow to the hands. Typically carpal tunnel can be you can avoid surgery most of the time. Unfortunately, in the conventional community, I see a lot of people get carpal tunnel surgery, and most of the time it's not necessary if they're given the right a prescription, exercise, laying off the repetitive motion, postural changes and stuff like that. I mean, how many nerve sheaths have you seen clipped from carpal tunnel, right?
Yeah.
It's kind of crazy. I mean, I see it all the time, and I'm like, it was basically, you get the diagnosis and you go right to surgery, and that should be the last option, as we always say on this podcast.
Yeah, absolutely. And the difference between mononeuropathy and polyneuropathy can help you kind of understand if you would be a candidate for surgery or need some further medical intervention. So for instance, in the carpal tunnel situation, that would be a mononeuropathy. You're going to experience it on one side, most likely, which means it's more of a mechanical cause. So that tells me as a physical therapist, I can go in there, I can possibly make some sort of change to whatever pressure is being placed on the nerve and causing this deteriorating of function. Whereas a polyneuropathy, where people are experiencing both feet are becoming numb, that tells me as a physical therapist is much less likely to be some sort of mechanical cause that I can address.
Okay. Yeah. So one of the main things we talked about, diabetes, right? So that gives you an idea of kind of nutrition, right? And lifestyle can affect this. So whether it's chemotherapy induced peripheral neuropathy, if the diet is not great and you have chemotherapy induced neuropathy, there's so much you can do to remove an obstacle to cure, so to speak, right? So poor nutrition is can be a big cause or a potential factor in how bad the symptoms are.
Right.
And under that heading is vitamin deficiencies and, basically nutraceutical subclinical deficiencies that you can do. Another big cause of peripheral neuropathy is alcoholism. And one of the reasons why is because it significantly depletes B vitamins. So alcoholism. So with my patients with this, it's like the first thing I'll do is get them off alcohol and then I'll have them on some type of good multivitamin, high potency multivitamin that has B vitamins in it, significant amounts of B vitamins, B6, P5P, B5, B12, folate. Like these things are really important and can help and can take the edge off. Other causes can be where, you have an autoimmune disease, which may cause it. Maybe you have kidney or thyroid disease. Maybe you have some type of infectious disease, Lyme disease, shingles, HIV, AIDS. All these can cause neuropathies. Certain medications also can too.
Yep. Yeah, absolutely. There's a whole gamut of things that can cause neuropathy. I mean, we could go on forever about what could cause it.
Right.
In reality, there's a ton of things.
So what is the standard treatment? Okay. Well, they're certainly not seeing me or you first, right? What they're seeing is they're seeing their MD, and the standard treatment tends to be, you're going to laugh at this, Brian, when I tell you, it tends to be antidepressants and anticonvulsants. All right. So the drugs you may see people on where they're trying to mitigate or reduce the severity of the symptoms is, the antidepressants, Effexor, Wellbutrin, amitriptyline, Paxil, anticonvulsants. The main ones that I see are gabapentin or Neurontin and Lyrica.
Yeah.
Those are the main ones. So, And here's the thing. None of them have shown to significantly help. They do help. I mean, some they can take the edge off, but they have not been shown to significantly help, and they don't prevent the damage from occurring.
Yeah, ding, ding, ding. That's a big point there. Like
Right.
gabapentin, it's big nerve pain medication, but it's not gonna. We're putting a blanket over the situation. We're not necessarily treating what's under the blanket.
Right. We're certainly not. And that's the treatment. And nothing.
Right.
They don't go into any. Typically any nutritional stuff. They
Right.
blow it off. They don't talk about any antioxidants or anything like that. Also, a big part of the treatment, right, is removing the offending agent. So, if you're trying to treat this, you may be fighting a losing battle if you're on some of these chemotherapeutic drugs still.
Yeah,
It's
absolutely.
not to say you can't treat. I mean, I would say treat if you can, but typically what I see with my patients is after they've had chemotherapy and then all of a sudden this side effect pops up and they're not able to sleep at night, and then they come. It'd be better if they came earlier.
Mm-hmm.
And here's the reason why, Brian, because one of the things the nerve cells, once they're damaged and once they're damaged and you don't treat and scarring occurs, you can't reverse that damage. Okay. That's not to say though that you can't help significantly with the symptoms, but it would be nice to start treating early so that, the nerves don't get so irritated. And I say this because there are some studies out there that show, like, people who are on a multivitamin or like fish oil or some of these nerve fortifying nutraceuticals tend not to get the severity of peripheral neuropathy from chemotherapy or the diabetes or any of these other factors that may cause it. So what does that say? It's typically like, yeah, it's probably a good idea if you know that you're going in to get chemotherapy treatment and part of the, side effect picture is this, and it can be miserable for people. At the very least, get on a multivitamin, high potency multivitamin with B vitamins and maybe an omega-3 supplement.
Right.
You may completely mitigate that side effect with that. But anyway, the people that we see have already got it. So that's not to mean that, they probably have some scarring with their nerves, right? So some nerves may be put out of commission because of that scarring. But clinically, what I've seen is that you still can reverse the symptoms of this, where it's not an issue, where it's not affecting your quality of life. So in my mind, what the science says is that, once a nerve is scarred, it's permanent damage. You can't reverse that. But look, I've been treating this for years, and you can significantly reduce the severity of the symptoms without the drugs, without the meds. And, in my mind, what does that tell me? That, you, at least as long as, you can kind of reverse this, whether that's to say the scarring happened or not, you can reverse it.
Yeah.
But start treatment early.
Yeah, absolutely. And I think this is where we could kind of get lost in the weeds because there are so many different types. But myelin, which is like essentially the conductor that's on the nerve, it helps the signal go quicker and smoother and more accurate along the nerve pathway. It just helps speed that conduction up. And that you can replenish that. A nerve will kind of regenerate at 1 millimeter a day. So you can, depending on what type of neuropathy it is, you have a different type of chance of actually regenerating some of those lost functions or some of the lost pieces of those lower motor nerves.
Right. So I know people just really want to know, okay, that's all fine and good. You guys are talking about peripheral neuropathy. You're telling us how it happens, giving us some idea of why it happens and all that. But I want to know what to do. And that's the main reason why we want to do this. Yeah. What do we do? Right. So I tend to have a protocol for this. And I use a number of nutraceuticals and herbal supplements, as well as some of the foundational stuff. One of them being, which me and you already talked about before we even got on, is exercise being one of the best treatments for it. Yeah. So just real briefly about exercise first. Exercise increases blood flow. it stimulates nerves to do their thing. So,
Yeah.
Exercise, the main cure all. You got to increase blood flow. If you don't have good blood flow to your dermatomes and to your peripheral body parts, you're going to be hard pressed to reverse this peripheral neuropathy. So
Yeah, you're not bringing the nutrition for that regeneration.
Right. You're not bringing the nutrition for that. So just real quickly, and then we'll go through some specifics on what I mean by the protocol that I do. And I'm going to just name out some compounds and things that I use that can really help. So this is just like a summary, and then we'll go back over it at the end. All right.
Okay.
The first thing that we do is we want to remove the offending agent. Okay. Whatever that can be. All right. And that doesn't mean that we have to remove the offending agent right away, because that offending agent may be diabetes itself. Okay. Right now, it may be the chemotherapy induced peripheral neuropathy. Typically, the chemotherapeutic drugs have been removed. Okay. The side effects have already happened. And then we start treatment. I do have people who come in, and I think it's better to come in right away as soon as they get the first signs and symptoms of that. So sometimes it can be during chemotherapy, which can really, really help. But first thing we do is it's kind of like a 4-pronged approach for me. I use some type of anti-inflammatory, all right, nutraceutical or medication, okay, some type of neuroprotectant, nutraceutical or medication. One basic neuroprotectant is fish oil. Okay. I use some type of antifibrotic. One type of antifibrotic compound you can think about this as the enzymes. This would be like bromelain or something called lumbrokinase. It's just enzymes that can, I don't know, kind of chew up fibrotic tissue, maybe inhibit the scarring from happening. Think about it that way. And then I use anabolics. And anabolics, I'm not talking about steroids like testosterone. I'm talking about nutraceuticals and herbs that, fortify the body and help regenerate neurons. And there's something that nerves secrete to help repair themselves. It's called nerve growth factor, nervous tissue growth factor. And some of these anabolics and supplements can help the body increase this nerve growth factor, which then, as the name implies, improve nerve function and help repair and rebuild.
Okay.
So as I go through these, I'll just kind of briefly talk about some of these as far as where they fall in these 4 categories. But typically I like to hit peripheral neuropathy with these 4 categories: anti-inflammatories, neuroprotectants, anabolics, and antifibrotics.
Okay.
All right.
Okay.
All right. So the first thing we did is we remove the offending agent. The next thing that we are going to do, removing the offending agent, would be like, okay, let's bring down blood sugar levels. Whether you have chemotherapy-induced peripheral neuropathy, you may also have diabetes on top of that. So that may be part of your treatment. Or it may just be sugar-induced stuff, or it may be another cause of this peripheral neuropathy. There are many causes, so you want to remove the offending agent, whatever that is, or at least mitigate it. So if we're talking about blood sugar issues, what do? We want to tend to eat on a more lower glycemic. We want to clean up the diet, essentially, right?
Yeah.
And one of the best diets to be on, also because you can get plenty of fats in there and nerve regenerating nutrients like fish oil, like sardines, like egg yolks, is like a ketogenic diet may help. And that's not to say that that's what you have to eat, but a diet that's high in fat and high in phytonutrients. So think ketogenic diet, combination Mediterranean diet, that type of thing would be a good thing to be on. Let's see. There are some. So let's just go over. Let me pull up notes here.
The high fat makes sense. I mean, it goes along with the myelin that we were discussing, which is fatty type tissue or more conductive or insulating type tissue.
Right. Yes. Just real quickly before we get into this is, so what blood tests would be helpful for this? So a hemoglobin A1C, that's kind of like can diagnose diabetes. It just tells you what your blood sugar is. A hemoglobin A1C that's in the pre-diabetic level is is causing nerve damage or potentially causing nerve damage. So you want to get a normal hemoglobin A1C. Optimal is less than 5 or less without blood sugar symptoms. Okay.
Okay.
There's another test out there. We've talked about homocysteine. That's an inflammatory marker test. Lower that, and there's another really good test that really gives you an idea of how the endothelial cells are function within blood vessels, which then are directly related to how much nitric oxide you produce. That test is called ADMA, asymmetric dimethylarginine test. This is a test that you'd be hard pressed to get done and hard pressed to get insurance to cover. But it's a test that I typically I'll run to just get an idea where we are. And then you have objective data. As you lower those, what you'll see with some of these nutraceutical interventions, you'll see that peripheral neuropathy gets better.
Yeah, it's going to be hard. From what I can tell, I'm not an expert in this aspect of it, but as far as finding out exactly what the cause is going to be tough, because it may be extremely obvious, or it may be a little bit more a little bit more hidden. But like carpal tunnel is not going to be necessarily a neuropathy at all if you have true carpal tunnel, because it's an actual disease of the nerve, a neuropathy. Correct me if I'm wrong. So it's a legit disease, a disease process that's going on that injuring the nerve. Yeah, versus like a carpal tunnel is pressure on a nerve that is causing the symptoms that would be very similar to peripheral neuropathy, if that makes sense.
Right. And that's why with this talk, I really want to focus on like the polyneuropathies where there's a number of things affecting it primarily, but yes, sometimes it's very obvious, you have chemotherapy and then boom, all of a sudden you get peripheral neuropathy. So the main cause of that.
Right. Or you have diabetes and you have that stocking glove type, both sides, all the way up to where you would pull your socks up, kind of tingly feelies.
Right. Exactly. So let's see where to start.
Four-pronged approach. Yes.
Yeah, the four-pronged approach. Okay. So we'll start with, why don't we just go through the different herbs, and I'll just talk about how where they stand and what they are. First one we already talked about B vitamins. We talked about fish oil. You can think about these as basically helping regenerate the nerves. Okay. They're just there to give the nerves building blocks to help them regenerate themselves.
Yeah.
All right. You can think about them as kind of falling into the category of, basically neuroprotectants, maybe cross between that and anabolics. An anti-inflammatory herb that I use quite a bit is Boswellia. Okay. And then, Boswellia is an anti-inflammatory herb, which, kind of falls under that rubric. Another one would be curcumin, which can certainly help. Neuroprotectants, the main ones that I use are going to be like acetyl L-carnitine. These are all nutraceuticals you can find. Typically I'll dose that about anywhere from 800 to 1 gram a day. And then alpha lipoic acid, we talked about that before. Both of the alpha lipoic acid is one of those things that I make sure that as far as my diabetic patients, they're on a multivitamin that has it in there. It will help protect nerves.
This is the neuroprotectant group, Keoni, is that correct?
Yes, I'd call them neuroprotectants. Absolutely. One thing that people may not be aware of that seems to be helpful for peripheral neuropathy is hypericum, which is really just St. John's wort. All right. And this plant traditionally has been used to help heal the nervous system. And it was just recently found in a study that, this herb basically helps the recovery of peripheral nerve regeneration. So you can use this herb topically and also internally for chemotherapy-induced neuropathies.
Is there I'm not sure if you know off the top of your head, but isn't there a specific class of medication you have to be careful with St. John's wort? Or am I wrong? Isn't St. John's wort one of those you got to be You just have to be obviously cautious with everything.
Yeah.
But
St. John's wort does seem to have an effect on the central nervous system. So any drugs that affect that,
I know
you
it's
may want to
used
be
for
careful
like
of.
anxiety and things
Right.
like that as
Yeah.
well.
Right. Yeah. So I just don't like combining that medication with any drugs that, you know, like any antidepressants or anything like that, pharmaceutical stuff. I mean, you may get, or any other neurotropic drugs.
Yeah, I think you say that pretty often, is that as far as like your nutraceuticals and your medications, you don't want
Yeah,
the
I
same
like to
sort of
just
attack.
right, and I like to take them apart too. Like
Right.
so you take them
Always.
at least an hour apart. Your nutraceuticals and stuff like that. I know hypericum topically, like there may be some. You want to probably, if I'm not mistaken, like avoid sunlight if you have it on topically.
Okay.
So, but yeah, there can be some issues, and there can be some issues with really, everything we're talking about here as far as side effects. But the side effects really tend to be a lot less than any of the side effects you'd see from prescription drugs or
Absolutely.
medications.
Yeah. Okay.
Yeah. So it's pretty neat. I mean, I'm looking at some studies here on meta-analysis uh, showing that St. John's wort, since we're giving antidepressants for prescription drug antidepressants, why not just give the St. John's wort, which seems to help with nerve regeneration, but to some extent, but also is known, according to some meta-analysis, of helping with mild to moderate depression, right?
Yeah.
So another herb that really helps is ginkgo.
Mm.
Ginkgo seems to help. Basically, in a rat study, the one study showed, and with a certain chemotherapeutic drug, it just showed that these mice tended to do a lot better as far as reducing nerve pain and all that by taking ginkgo. Ginkgo seems to just reduce pain intensity and improves the sense of touch. Usually it takes like 3 to 6 months to do that. This is a very safe herb to take.
Okay.
There's another thing that I give quite a bit, and this one is called Huperzine A. It just comes from, what's the herb it comes from? I think it comes from like club moss. That's the herb. Anyway, it's very well tolerated. You'll see it in brain nutraceutical, brain enhancement, memory enhancement nutraceuticals.
Yeah. It's in Alpha Brain, which is a nootropic that I take sometimes.
Yeah, and it seems to possess an analgesic effect against neuropathic pain. So that's another one that's good, and it's safe. Sage, the herb sage, I may use, and that's salvia. In Chinese medicine, they use this herb a lot, Salvia militariza, and it's pretty amazing what it does for helping with cardiovascular stuff. And it seems to be useful for vincristine-induced, that's a chemotherapeutic drug for peripheral neuropathy. But
Okay.
it's an anti-inflammatory, it's an antioxidant, it helps with blood flow. So in Chinese medicine, salvia is prescribed for any type of cardiovascular stagnation of blood type issues. Just think about like cardiovascular disease and viscosity of blood and how sage may help with that.
Okay. And these are all still the neuroprotectant groups. So this is the group that you would take.
These things not only neuroprotective, but they also seem to fortify. So there's some crossover here.
Right.
And I'll just mention like the ones that they fall under certain categories, like definite known certain categories. I'll mention them. Most of these have, help in different categories here. So they're not only nerve protectants, they also, they're antioxidants. None of them that are like antifibrotics or anything like that. But, they have broad acting effects.
Absolutely. But to your point, these are unfortunately you find out you have to get chemotherapy, you can start these up along with the guidance of your doctor.
Yeah. Right. So you can think about these as falling under anti-inflammatories, neuroprotectants, primarily. That's where I'd put those. What about anabolic type herbs or nutraceuticals? Glutamine would be one. Another one would be creatine. Would be kind of an anabolic nutraceutical. Let's see.
And just so people are clear, when anabolic, we're just basically something that's going to help you build up.
Right. That's what we're talking
about. A building block.
Right. Raponticum. It's RHAPONTICUM. See, it's an herb component that tends to be an anabolic. You can find this in certain anabolic nerve formulations. And then magnesium / glutamine is a really good one. Glutamine that comes in the form of magnesium glycyl glutamine. Both the magnesium in that form and the glutamine are really well absorbed. That's the form I use for peripheral neuropathy. All right, so think about these as more anabolics. As far as helping with antifibrotics, we mentioned those: lumbrokinase, bromelain, serrapeptidase, any type of enzymatic compound. Just think about it chewing up fibrotic tissue can really help. We mentioned creatine. Another one would be, as far as falling under the, well, this one has basically broad spectrum, but another one is called PEA. I really love this one because PEA is found in high amounts of cocoa. It's also found in high amounts in egg yolk. And this, I guess you could put this under anabolics. It will tend to build up the myelin sheath. By the way, foods that tend to build the myelin sheath are going to be egg yolks, think about healthy fatty foods: egg yolks, sardines, nuts, seeds, cocoa. Legumes can also help that too.
Yeah.
Let's see. I think that pretty much, there's other herbs I use that can help with pain. Like one thing that people can do, and they can just get this over the counter just to help, which I think helps better than the drugs, is just like the chili lotions, the chili pepper lotions that you can get out there.
I have not heard of that.
Well, you can go to any drugstore and get capsaicin cream, and you can rub that on your feet or your hands, and it significantly helps take the edge off. So that's just something you can get and use topically. The other herbs I use quite a bit, Corydalis, it's kind of a Chinese herb. It's great for pain. Amla, that's Indian gooseberry, very high in vitamin C. It helps significantly with helping the nerves regenerate, and it seems to have some anti-pain activity. Rosemary is another one. So look, guys, I know I'm throwing out a ton of herbs there, and typically I'm not throwing all this at my patients with peripheral neuropathy, but right. I just want to bring this up, Ryan. I want to bring it up that there's so many other herbs out there that have studies, and I'm mentioning these things that actually have studies, and I don't really want to go into studies that have studies that back them up for their use in peripheral neuropathy, because I know most people have no idea about any of this, and they're just using their drug medications with very little effect most of the time, and there's so much more out there that they can use to help them and to possibly get off the medications, which have plenty side effects. Another herb is Centella asiatica, that's gotu kola, if people have heard of that. It's effective in reducing the sensory symptoms, in a number of studies. I think there's a study out of Indian J Farm of Science in 2010, 33 subjects completed this 52-week randomized double-blind placebo-controlled study. And they were taking 240 milligrams of Centella, and at the end of it, they just showed that their symptoms got better. with peripheral neuropathy. Let's see, what else? Andrographis is another herb, tends to be more of a Chinese herb. I use it quite a bit. It tends to be, it helps with it's an anti-inflammatory, has an anti-inflammatory effect. See if I can find a study here.
Well, so within your 4-prong approach, Keoni, the wire carrying the prongs would be exercise. So absolutely, and the main point of that is just to increase the circulation and bring the nutrition to that area. So as a physical therapist, if you go see a physical therapist for peripheral neuropathy, for one of the 2 main reasons that we've mentioned it's going to be about increasing blood flow to that area, which is going to help regenerate, neuroprotect, all these sorts of things, because we get all these good substances brought to that area when we are exercising and increasing the blood flow to these areas.
With andrographis, there was a study that in mice that showed improvement, sensory improvement. If you guys aren't interested, Farm Biology 2018 of December, volume 56.
I am interested in how they measured the sensory of the rat.
Yeah, I don't know.
They tickled him in one spot and he reacted, and they tickled him again and he didn't react.
And then there's another study. I think this one is it's a human study where they use andrographis co-administered with a COX-2 inhibitor. And by the way, COX-2 inhibitors, I know some of them have been taken off the market, but like COX-2 inhibitor Celebrex can significantly help. And it seems to help just as well, if not better, than gabapentin or any of the antidepressants out there.
Yeah.
So, and then what is the name of the drug that helps with increasing blood flow? Trentil. And that's another one that seems to help. It improves blood flow to the nerves. I think Trentil, Trental, that may be a drug that you may want to consider also to help take the edge off, that you can use these in combination while using some of these natural therapeutic approaches.
Yeah.
Okay, and then last but not least, and I'll go back over this because I know we've been jumping around, but last but not least is one of the main ways I treat this, Brian, is I use acupuncture and I use electrostim. So typically the way I'll do it is, let's say they come with all the dermatomes on the bottom of the feet are affected. They're getting these sensory nerve things. They're tripping. They're cutting their feet up or whatever. They don't have any feeling, whatever the cause may be, to just enhance nerve function and increase blood flow from there. I will put needles at kidney 1, that's on the bottom of the foot, kind of at the ball of the foot. Liver 3, that's at the anterior foot between the big toe and little toe. And then I will also put a needle on the 2 sides of the feet at various acupuncture points there. And I will run a current. I'll cross the current between the top and the bottom of the foot and the sides of the foot. And I'll run it there, and I'll run it for anywhere from 20 minutes on both feet. Usually it's both feet that are affected. And within 1 to 3 treatments, the edge is taken off of the pain. Where the pain is gone, they can finally sleep and stuff like that. And then I'll use a lot of these nutraceutical interventions. I will talk about exercise. I mean, exercise is so important. Another non-invasive therapy is infrared light therapy, which has some research that shows that it helps also. We talked about the foods, any foods that help build up the myelin sheath, nerve regenerative foods, egg yolk, sardines, nuts, seeds, cocoa, legumes, but generally a healthy diet. And then nutraceuticals, the next stage down is like omega-3s. Make sure you're on a good high potency B vitamin. That's so important. And then the next stage down is I will go into this 4-pronged approach and use probably, a couple nutraceuticals from each of these and maybe rotate them with my 4-pronged approach. And that 4-pronged approach, it includes, neuroprotectants, right? So we're maybe talking about alpha lipoic acid, acetyl L-carnitine, antifibrotics, lumbrokinase, bromelain, anti-inflammatories, thinking about boswellia, possibly curcumin, and then my anabolics. Many of the herbs that we mentioned are the anabolics, and I'll use that glutamine magnesium formulation, creatine there, salvia. What are the other herbs? Corydalis. I actually use a specific formulation that's a combination of anabolic herbs that I'll give my patients there. And there's a number of formulations out there. There's a couple specific formulations that I like that has a lot of these herbs in here that I mentioned. And that's what we'll do. And then we'll keep them on that for like 2 to 3 months. And then as the symptoms get better and as the quality of life gets better, then we take them off of that stuff. But I'll usually keep them on the basics though, right? So like a good high potency B vitamin and some type of omega-3 or omega-6 supplement, like a healthy omega-6 supplement that's a combination product with omega-3s. And that's it. And I know we went through a lot today, but no matter what your cause is of this peripheral neuropathy, these interventions will help.
Yeah.
And guys, I know that you can't see me, or you may not be able to see Brian or be referred to this, but hey, if you have a medically trained naturopathic physician in your area, this is the way to go. Like, just consult with them. You can always consult with me, do phone consults or anything like that. Acupuncturists are a great resource. Physical therapists are a great resource, especially if the pharmaceutical interventions are not getting it. Keep in mind, the pharmaceutical interventions are not reversing this at all.
Right.
They're just mitigating the symptoms.
Yeah, absolutely. Absolutely. And I'd be remiss if I didn't mention, just at whatever stage it's at, you need to be checking these areas. You need to, like, if it's diabetic cause, you need to be checking your feet for ulcers or anything that you could possibly step on if you're not feeling your feet very well. Mm-hmm. Your gait may be abnormal because you're not feeling the positioning of your ankle or that sort of thing. So just taking extra caution, with being aware that you're not necessarily getting the best proprioceptive input on your positioning or that sort of thing. Or you may think you're clearing the ledge and you're not clearing the ledge, and that could be a problem for certainly someone who's going down chemotherapy treatment and experiencing this neuropathy and, is in their 60s, 70s, or 80s.
Right.
Just making those, being aware of all the side effects of this as well, regardless of the pain, which we're definitely addressing here.
The other thing, Brian, I just want to mention real quick, I've been mentioning B vitamins, and I know people will be like, well, I'm going to run out and get a B complex, and that will be helpful. But honestly, you want a high potency multivitamin, because it's not just about B vitamins. It's about, certain minerals. Magnesium, zinc has studies that show that it helps. Vitamin D shows that it helps. So a good, complete multi. I use a fish oil that you get at least 2 grams of fish oil in 2 caps, which is, that's unheard of almost. You get the EPA, DHA in there, but also I combine it with vitamin D. So it will reduce the number of pills too. So you get like 1,000 IU of vitamin D on top of it. So these are things that, your local functional medicine practitioner, naturopath can help you with. But I really like the multivitamin, high potency multivitamin approach for this, instead of just running out and getting the B complex, and a good quality one, which we certainly can help.
Yeah, absolutely. Thanks for educating, Keoni. That was, I feel like I knew a quarter of it. That's awesome.
Yeah, I felt like I was jumping around, but I think the main thing people should just go away with is there's a lot more you can do with this, because I know a lot of my patients are at their wits' end with this and just feel like, I've actually had one patient tell me, like, I wouldn't even gotten treated with chemotherapy if I knew this is what I'd have to live with.
Yeah.
And that's awful, because basically you're saying, okay, I'll take the cancer as long as I have, a few years left in me of good quality life, whereas the chemotherapy treatment, in many cases can, extend your life well on to old age, depending on where you get it, but, it's unfortunate if you think that all you have there are your, gabapentin, which can be, some of these drugs, depending on year to year, can cost a tremendous amount of money, and insurance may not cover them, and so on and so on. So there's so much that you can do outside of it.
Yeah, absolutely. If people want to work with Keoni specifically, his website link is in the show notes, so you can contact him that way.
Yeah. All right. Well, thanks everybody.
Yes. Until next week, be well.